My husband, Dave Maddox, was a full-time farmer for nearly 50 of his 69 years. For over 20 years, here in the Comox Valley, we grew everything from A to Z. Asparagus to zucchinis, asters to zinnias. We sold our tons and tons of produce and baskets of flowers at Spring Hill on our on-farm market. We planted our final 65 acres of vegetables in 1999 and sold our last sack of potatoes in 2000. Dave and I were always mindful of our huge responsibility as farmers to produce safe and nutritious food. We applied IPM methods using beneficial biologicals and yellow sticky trap monitoring systems to control insect pests in our field crops and 1.5 acres of greenhouses. We grew vegetable varieties that actually tasted delicious, carrots that were so tender that mechanical harvesting was not possible. Frequently, especially towards the end of our farming careers, we noticed that a lot of our customers were actually interested in the way we raised our crops. They even expressed gratitude that we employed crop management practices that produced food worth ingesting. It's always nice to be acknowledged, not just taken for granted when you're doing something worthwhile. A long time ago, I saw a cartoon that depicted a grade 1 teacher asking her class where milk comes from. A little kid jumped up and hollered confidently, "From the grocery store." That scenario just wouldn't happen nowadays. People and their children are much more savvy. More and more, people want to know where the components of their meals come from. People care about who produces their food and that ethical, careful, and caring procedures are employed. It's time to be just as interested in where our medications come from, to insist that ethical, careful, and caring procedures are used when increasing our cornucopia of medical remedies that allow us to survive and live longer. And we do live longer. My dad is almost 94 thanks to heart medications. My grandson has survived umpteen asthma attacks thanks to puffers. And my sister-in-law is free of breast cancer thanks to chemotherapy. Antibiotics, insulin, antidepressants, painkillers, the range of medications is mind-boggling, and yet more will be needed, especially to combat cancer. According to the World Health Organization, 1 out of 3 adults worldwide dies of cancer. Cancer. My husband Dave died last Sunday, December 4, 6 years ago. In August of 2005, he was diagnosed with esophageal cancer that had metastasized to his liver. No treatment options could be offered. He was given 6 months to live. Dave was the 4th member of his family, his dad and 3 of his brothers, to be given cancer diagnosis. Again, according to the World Health Organization, by the year 2030, 50% of the world's population will receive a diagnosis of cancer. Oh my God, that's 4 billion people, men, women, and children. Will we just stand still like deer in the headlights and await our fate? Our collective no has been the impetus to amass billions of dollars to fire up the engines of the biomedical research industry. Bench researchers, lab animals, clinical trials are all basic components of the biomedical research industry, of which Canada has the 5th largest in the world. The average person might think that other than donating money and time to charities fueling the medical research engines, they have no role to play in the search for a cure. Wrong. You are not likely to be drafted to work as a bench researcher. And if you are not a rat, a genetically engineered mouse, a monkey, or a dog, the laboratory animal role is not open to you. But listen up, people. It is you, Guy Average, Molly Homemaker, and freckle-faced little kid Fred, who gets to do the clinical trial part. Just maybe a clinical trial is in your future. So, what is a clinical trial? Clinical trials are medical experiments in which newly invented prescription drugs or medical devices are tried out on human beings. Why are clinical trials conducted? Because we, the public, want to be safeguarded. What is the format of a clinical trial? There are 3 phases in a clinical trial: Phase 1, Phase 2, and Phase 3, and all 3 phases must be successfully completed before a medical product is granted marketing approval. In Canada, the licensing body is an arm of Health Canada, the Therapeutic Products Division. So what is the purpose of each phase of a clinical trial of an investigational drug? In phase 1, it's to identify the safe dose. In phase 2, is to decide if the safe dose works. And in phase 3, is to compare the safe dose with other drugs to see if it's better in some way. These 3 phases build on one another and are thus conducted sequentially, not simultaneously. Less than 20% of drugs that begin the clinical trial process ever get to market. More than 80% fail for various reasons. They don't work, the side effects are horrendous, the company runs out of money, a myriad of reasons. In September of 2005, Dave was contacted by the Vancouver Cancer Agency and asked to volunteer to help find the safe dose of CPX-1. CPX-1 was a cocktail of 2 well-known chemotherapy drugs, but what was new was having those 2 drugs encapsulated within fat liposomes. That drug delivery innovation maximized and kept constant the cancer-killing power of both drugs. Most new cancer drugs use some components of existing treatments. New scientific research builds on previous research data and experience. And that is why it is critical that the world medical research community is aware of each and every clinical trial. If researchers are aware that a clinical trial has taken place, they can then follow up and get the results. For it is important to be informed of what doesn't work as well as what does. Dave and I were totally naive about how researchers went about finding the safe dose of a new drug, but we learned. Here are the ground rules for a phase 1. In order to determine the safe dose of a new cancer drug, researchers recruit terminally ill cancer patients and ask them to take the investigational drug. Phase 1 trials are escalating dose studies. The schedule for increasing the dose is set by the sponsor who is funding the trial. That schedule is vetted by Health Canada. 80% of all drugs in clinical trials are sponsored by pharmaceutical companies who make a financial arrangement with one or more of our public institutions to conduct a phase of a clinical trial. The ethics board for each contracted public institution also vets the sponsor's dosing schedule. The sponsor provides the contracted institution's phase 1 team with the expected outcome of the trial in a document called the sponsor's brochure. The first dose of the test drug administered to a human being is a dosage that the lab animals were able to tolerate. Each small group of human test subjects stays on the dose assigned to that group for the duration of the trial. And here's how a phase 1 trial actually works. 3 or 4 test subjects are recruited and given the initial dose. If they experience no or minimal side effects, another 3 or 4 terminally ill patients are recruited and the dosage amount is increased as per the sponsor's dose schedule. If the second group of test subjects or cohort has minimal or manageable side effects, is administered, this recruit a new cohort and increase the dose pattern continues until the cohort suffers severe side effects or death caused by severe side effects. At that point, the phase 1 trial is deemed a success and is stopped. For once the lethal dose is known, researchers can backtrack to determine the safe dose. For just 13 days, Dave was in the 6th cohort of the phase 1 trial of CPX-1. Dave dehydrated to death over a period of 8 days. A woman also in the 6th cohort was able to be saved, but it took 30 days before she rallied. The other 2 volunteers were enrolled by a Montreal institution that shared the CPX-1 contract, and they were saved. The dosage given to the 5th cohort was designated the safe dose of CPX-1. So this is what phase 1 clinical trial volunteers do for you so that you have a chance to fight the disease. In a phase 1 trial, it doesn't matter what kind of cancer the volunteer has. Researchers just need a dying body whose major organs are still functioning well enough to process the drug. When testing for efficacy in phase 2, people are recruited that have the type of cancer that the drug was actually designed to combat. Phase 1 trials are conducted on an outpatient basis. The terminally ill volunteer must agree to move to the immediate vicinity of the contracted public institution for the first 30 days of the trial. After those 30 days, the volunteer can return home, but must agree to return for the next dose. There are 10 cities in Canada that have public institutions conducting Phase 1 cancer clinical trials. The Phase 1 volunteer pays all travel, rented accommodation, meals, and parking costs. As well, they must agree to provide copious samples of blood in order for researchers to track the course of the drug passing through the test subject's body. Dave went to the lab for blood work 16 times in the first 5 days of the trial. Every Phase 1 clinical trial volunteer must sign a subject information and consent form. By signing the consent form, the Phase 1 volunteer is allowing research doctors to do harm, for that is the intent of a Phase 1 clinical trial. The consent form frankly states, since there is very little information about the drug's effect on cancer in humans, we do not expect that you will benefit from taking part in this study, although the knowledge gained may benefit others. According to Professor of Oncology Martin Tattersall, University of Sydney, Australia, the likelihood of Phase 1 volunteers experiencing any personal health benefit is below 4%. The consent form rhetoric reassures the Phase 1 recruit with words such as, subjects are given the new drug and are watched very closely to see what side effects they have, quote, all care will be taken, quote, your study doctor will watch you closely, quote, other drugs will be given to make the side effects less serious and uncomfortable, quote, your safety is our primary concern. But as an outpatient, the day-to-day reality is the Phase 1 volunteer is responsible for monitoring themselves. Despite those promises of care, Dave was denied admission to the hospital, even though he was violently ill for days, and by then his daily blood tests indicated his kidneys were failing. The Phase 1 doctor said no beds were available. After collapsing in our rented room and becoming comatose, Dave was taken to VGH emergency, where he died 11 grueling hours later of renal failure due to CPX-1. Dave's horrific end-of-life journey has inspired me, along with friends and family, to rectify the, well, he was going to die anyway, response from researchers when I voiced my outrage at their callous neglect of Dave. We established a national charitable organization, the Baron Ewan Mind Foundation, and now have in place a support program called Research with Respect. To any Phase 1 cancer clinical trial volunteer, we offer a daily visit from a registered nurse during the 30-day away-from-home period. This free service is available across Canada, and no donations, please. In setting up Research with Respect, we became aware that Health Canada has shirked its responsibility to guarantee that the knowledge gained will be distributed so that there is a possibility that it may benefit others. Health Canada has made it mandatory for clinical trials sponsored by taxpayers to be registered on a public clinical trials registry, but neglects to specify which country's registry. And Health Canada has made it mandatory for publicly funded clinical trials to publish the results in a timely manner. However, Health Canada does not have the same requirements for pharmaceutical companies sponsoring clinical trials. 80% of all clinical trials are sponsored by pharmaceutical companies. The Ottawa Group, organized by a small band of activist academics, precisely states the concern. When members of the public agree to participate in trials, it is on the understanding that they are contributing to the global body of health-related knowledge. It is thus unethical to conduct human research without ensuring that valid descriptions of the study and its findings are publicly available. That Canada hasn't established its own public clinical trials registry is shameful. Just last month, the Auditor General slammed Health Canada for its failure to foster accountability and transparency in the drug approval process. The AG cited the case of a child recruited into a clinical trial that had not been vetted by Health Canada. The child's parents had contacted Health Canada with their concerns about their child's safety and discovered it was an illegal experiment that their child was in. If Health Canada had mandatory public registration of every clinical trial on a central public registry, such a travesty could not have happened. So, what exactly is a public clinical trials registry? It's a central repository, a list of key information about clinical trials. It must be a not-for-profit registry with free and open access to researchers, clinicians, and the general public. The reasons to establish a public registry of clinical trials is to prevent duplication, to honor promises made to test subjects, to give the public access to current options, to avoid waste, to promote industry, transparency, and accountability. The Australia-New Zealand Clinical Trials Registry has offered to share its programming templates to assist Canada in establishing its own public registry. That registry's manager informed me that it cost them $250,000 to set up their registry and that $500,000 per year is required to maintain it. The WHO Clinical Trials Platform Coordinator is also eager to assist, anticipating that a French language component would be included. Yet, Health Canada remains unconvinced of the value of a public clinical trials registry. Our foundation is confident that if the Canadian public is made aware of the existence and generosity of clinical trial subjects, they will insist that the promises made to these altruistic citizens be honored. In working to raise public recognition of the vital role of Phase 1 volunteers, we have recently published Lethal Dose, which relates Dave's story and the aftermath. We have donated Lethal Dose to all the public libraries across Canada. Our local libraries have several copies, as has North Island College and all the local high schools. I urge you to go to our website and download our petition letter to the Minister of Health asking that a Canadian public registry of clinical trials be established. Mailing in that petition letter can be your way of expressing gratitude to those citizen heroes whose self-sacrifice should be acknowledged and not taken for granted. When counting your blessings, add in the thousands of Phase 1 volunteers worldwide who are at this very moment anonymously assisting you and the rest of mankind in the fight against cancer and other daunting diseases. And the next time you pop a pill, give a thought to all the clinical trial subjects who made that remedy possible, ladies and gentlemen.